I would say that, let's say you want to become a first violin in a symphony. You have to practice and practice and practice for thousands and thousands of hours to be able to get that spot, if you have even the abilities to do that. But let's say you do become first violin in a symphony, then you have to still practice every day. And if you stop practicing after a week, maybe not everybody's going to notice. But after a month, I think everybody's going to notice. And after 6 months, you're probably going to be losing your job. So I think it's the same thing. If you stop doing things in your life, then these abilities will start going down. In fact, the cognitive decline happens in everybody, but it doesn't start when we're 60 or 70 or 80 years old. It starts when we're 30 years old, and it starts declining slowly. Why? It's not exactly sure. Maybe we're not in the same mode where after 30 years old, we're out of school and we're just users of the abilities that we acquired, and we're not really training as much. That's my theory. But one thing is that if you keep training, it's going to build you a reserve that's going to help you compensate for the effect of the disease. So we don't know if really cognitive training can mitigate or have an impact on the disease itself. But what it can do is to give you a reserve to help combat the effect of the illness. So I would say that we don't have very strong evidence that really proves this point, but there's accumulating data that shows that having more reserve really helps compensate and helps someone stay autonomous at home and really keep doing things in a more meaningful way.